Welcome from the Wisconsin Association of Local Health Departments and Boards, or WALHDAB. I'm Nathan Lutke, Health Officer for Marquette County. Today's presentation will cover the purpose, accomplishments, and ways you can become involved with WALHDAB. WALHDAB was formed from the merger of two organizations, the Wisconsin Association of Health Officers and Boards and the Wisconsin Conference of Local Public Health Officials. It also serves as the State Association for City and County Health Officials, or SACHO, for the state of Wisconsin. The purpose of WALHDAB is to be the statewide leader for local governmental public health, and its vision is to be a recognized leader in the improvement of community health. If you are a local health department staff or a Board of Health member, you are a member of WALHDAB. WALHDAB is organized by regions. Each region meets on a monthly or bi-monthly basis, and each region has both a Board of Health member and a health officer representative that serves on the Board of Directors. WALHDAB also supports three sections: the Public Health Laboratory Network, the Environmental Health section, and the Nutrition section. Each of these also has a representative on the Board of Directors. Priorities from the most recent strategic plan include advocacy and policy change, education and training, and building the organization. Advocacy is done in cooperation with the Wisconsin Public Health Association, or WPHA. Some recent victories include the increase in cigarette tax to deter smokers, smoke-free indoor air, which offers smoke-free environments in public places, and the ability of school districts to exceed revenue caps for school nurses. Education is also key for WALHDAB, and one of our greatest victories is the WPHA and WALHDAB combined annual conference, which has been offered since 2004. We offer a new Board of Health member orientation and training during this, as well as presentations on new initiatives and other education on public health issues that are relevant. Developing partnerships is key as well for WALHDAB, along with developing the workforce and improving practice. Some of the measures taken to address this include the Multi-State Learning Collaborative, which works towards accreditation for local health departments. This includes assessment, quality assurance, and strategic planning for local health departments. The Practice-Based Research Network grant works to link research with public health practice so that the needs of public health providers is met. Other efforts include public affairs, which is done jointly again with WPHA and WALHDAB to establish a legislative agenda. And the most recent addition is the Survive and Thrive grant, which will offer leadership and professional development training for new health officers in Wisconsin. So why is WALHDAB important to your local organization? Because all politics are local. WALHDAB works to track current legislative issues, organize any advocacy that is necessary, and identify possible funding sources for public health in the future. Education is also a key element for WALHDAB and is offered during regional meetings and at the annual conference. WALHDAB is able to be efficient with its use of resources by utilizing state agency contacts and offering low-cost and presentations with local perspective at regional meetings. Networking is yet another strong value of WALHDAB and is done usually primarily through our regional meetings, where we can have discussions about current issues, gain new education, and get updates on committees and sections throughout the state. This is then taken to the Board of Directors and can provide a collaborative voice at a state level. Because improving public health is the main point for WALHDAB, improving public health practice is also important. We do this through sharing of local policies, sharing of best practices, and lessons learned so that we can collectively address these more complex issues. Again, just to recap, the Multi-State Learning Collaborative addresses accreditation. The Public Health Practice-Based Research Network helps to link research with public health practice. We also establish a legislative agenda and do a lot of conference planning. Now remember, this is your organization. If you are a local health department staff or a Board of Health member, you belong to WALHDAB. So get involved. Wisconsin statutes offer a unique opportunity for the Board of Health, as it states that you shall advocate for the provision of reasonable and necessary public health services, develop policy and provide leadership, and assure that measures are taken so that you create a healthy environment for the individuals in your local area. Other opportunities for you through WALHDAB include helping to create a legislative agenda, staying current on policy issues, planning educational programs, attending state, regional, and national meetings, attending the annual meeting, and staying informed through alerts, conferences, and other means. You can certainly benefit from your involvement in an organization, and the organization will benefit you as well. For more information, you can contact us at www.WALHDAB.flv or call 920-560-5635 or talk with your local health officer. Thank you, and we invite you to become involved in our efforts to improve Wisconsin's health.